And please welcome Dr. Manolakis. She is a physician over at the Borland-Groover Clinic. Thank you to for coming on the show. We appreciate you. So let's talk about this because it can be a very serious thing, and we'll get to that. But first of all, what is Gerd? What are some of the symptoms that people might be exhibiting?
Well, great. Well, thank you guys very much for having us. Now, Gerd actually is an acronym which stands for gastroesophageal reflux disease. And when people think of heartburn or they think of indigestion, typically this is what they are describing. Now, commonly when we see Gerd, it's kind of a burning sensation beneath the breastbone. Now, often it can also present with a burning sensation in the top of the stomach or kind of a reflux of contents up and down the esophagus or an acid taste in the back of the mouth. Now, you did mention there are some atypical type of symptoms or what we call more unusual symptoms that people may not at all relate to reflux disease, which can include a sore throat or a chronic cough. Sometimes difficulty swallowing also is more of an unusual manifestation of gastroesophageal reflux disease.
Okay, and is this a pretty common problem? I mean, how many people across the United States do you think have this?
Yes, it is a very common problem. I would guess probably every adult has had reflux at some point, typically after maybe overindulging in food. But up to 25% of the population, and this is even increasing constantly over time, has frequent and significant enough symptoms to require a daily medical intervention.
Well, and at what point in time does this become a serious problem? I mean, is it just for some people an annoyance, or if left untreated, is this something that can be very serious?
Right, that's a very good question. And for some people, it is just a minor annoyance and it can be treated on an as-needed basis. For other individuals, particularly if this has gone on for a long period of time, it can lead to an inflammation of the esophagus, known as esophagitis. And if esophagitis persists, this can lead to a scarring of the esophagus and a stricturizing, which may require actually your doctor to stretch this out, and that would require more advanced, medical therapy over a longer period of time.
So it's important to try to
certainly
get in as soon as possible.
Absolutely. And really the most, concerning side effect is the development of what we call Barrett's esophagus, which is a precancerous change of the esophagus, which eventually may lead to esophageal cancer, specifically adenocarcinoma, which is a devastating diagnosis.
If someone comes in and they've just had this persistent heartburn, are you able to determine, it's one of those things where I get it, I just ignore it, I just kind of go on with my daily routine. But, it's one of those things that I guess has been around for a while. If I go in and see you, can you determine then if there's a really serious problem brewing and I've just been ignoring it for a long time?
We can, and actually that may require a little bit more thorough of an evaluation. I would say being a young, otherwise healthy woman, if you did try an acid-reducing medicine, specifically something like a proton pump inhibitor, and these are medicines like Nexium and Prilosec, both of which are available over the counter now.
And is that something that people should be considering taking right now if they have acid reflux?
It will help improve the symptoms, but there is a specific demographic that can be a little bit more at risk for, more adverse events and outcomes. And this is typically men of Caucasian descent over age 45 to 50 with a long-standing history of reflux type symptoms, and that should be investigated a little bit further. Again, if you treat the symptom and it goes away, that is all well and good. If you treat the symptom and it doesn't go away, that also requires a little bit more further of an investigation.
Yeah, and then what would be then the treatment for Gerd, or, heaven forbid it's anything worse than that?
Right, and typically if it is just reflux and even some of the more complicated reflux events, we do use the acid-reducing PPIs. Now, really very exciting for my group, and in this area we are offering the Muse procedure, which is actually a fundoplication therapy. So previously this required surgery, but now it is done endoscopically. It has the same outcomes as people who have had surgery. It will decrease reflux events. It does improve quality of life. And I think long-term we're going to see it's actually a more cost-effective option than having to undergo a surgical intervention.
Yeah, so the bottom line is you have the heartburn, you're putting up with it now, come in, make sure it's not something more serious.
That's right.
And get it taken care of. You don't have to deal with it.
Absolutely.
Dr. Manolakis, it's so
Thank
good to see you.
Thank you so much for having me.
Being here. We'd like to thank the Borland-Groover Clinic for sponsoring this segment. You can